morning, everyone. Every 20 seconds, one Indian suffers from a brain stroke, and the numbers are increasing alarmingly due to the changing lifestyles. In recent years, the rate of stroke has doubled among younger people, and 1 in 7 strokes occur in people ages 15 to 49. Welcome to our latest episode of Wake Up to Health Talks. We have with us today Dr. Prayag Makwana, a neurologist and stroke specialist, to talk to us about brain attacks and how to win over them. Welcome, Dr. Makwana.
Thank you. Good afternoon, everyone. I'm Dr. Prayag Makwana, and I'm a neurologist. And after doing DM neurology, I've done a fellowship in stroke and interventional neurology of 1 year duration from Cadila. And I'm currently practicing in Surat as a neurologist and stroke specialist. And thank you.
Thank you for joining us today, sir. Your esteemed presence and your knowledge will definitely help us in this conversation today. So, sir, we all know about stroke and how it can be fatal, but there have been researchers that have said that the strokes seen in younger people is actually different from what is seen amongst the older generation. Can you shed some more light on this?
Stroke can occur at any age, but is commonly seen at elder age, after 50 years or 60 years. That was the initial scenario, but recently more people are suffering from stroke at a younger age. So there are some differences in stroke at different age groups. Strokes are even seen in pediatric age group. Those are most likely due to vascular anomaly or developmental disorders and vasculitis. In the younger adults, the commonest causes of stroke are again vasculitis and also early atherosclerosis. Cardiac cause of stroke remains a predominant cause of stroke at all age groups. Elderly people have a progressive atherosclerosis, due to which the blood vessels have calcified plaques thickened, and those plaques, when they dislodge, they interrupt blood supply in major intracranial blood vessels, and then they cause stroke.
So, sir, thank you for this. But there is a common misconception, and there's a lack of information about how to identify whether I might be suffering from stroke or not. So, what are these common symptoms, that can help you identify whether you're suffering from stroke?
So stroke treatment depends on identifying symptoms of stroke by a patient's relatives or patient, and then reaching the hospital. So for any caregiver or anyone, it is quite easy to remember the symptoms of stroke. First is we are also using this acronym B FAST. B is for balance. If the patient is suffering any unsteadiness in balance, like patient is falling, then E is for eyes. If there is any problem in visual disturbance, then there is F is for face. So if there is any facial weakness of one side, and there is associated difficulty in there is a facial asymmetry. A is for arm or leg weakness of one side, especially. Even if there is slight drooping, or even if there is slight weakness of arm or leg, then it is a very major symptom of stroke. Then S is for speech. If there is any difficulty in speech, the speech is not clear, the words cannot be easily understood, and also if there is just unable to comprehend simple things, that is. And T is for time. So you have to identify these symptoms very fast, and then take the patient to an emergency room at a hospital.
I think this Be Fast acronym can be, helpful for all of us, to understand whether, we are having a.
Because Be Fast is can be easily remembered, and once we remember it, then the patient's relatives can easily recognize the symptoms.
Exactly. So, sir, as you said that as soon as you get to know that you're suffering from a stroke, it's important to immediately consult a doctor and rush to the hospital. But
Yeah.
in that duration of the time, what is some things that the caregiver should know, and some things that the caregiver should take care of.
See, the caregiver should identify these symptoms very fast and respond to these symptoms very fast. Patient's relatives should be aware of the nearest hospital
Mm-hmm.
where some form of radio imaging facility is available, like
Mm-hmm.
CT scan or MRI, and they should call. They should not waste time, basically, because time is brain. So, and they should give. They should, one important thing that the patient's relatives should always remember is to have a approximate note of the onset of these symptoms.
Mm-hmm.
Especially many patients develop stroke, then when they go to sleep at night they are fine, but in the morning the patient's relatives identify that the patient is having one-sided weakness.
Mm-hmm.
But sometimes what happens is that when the patient, in these cases, okay, in the case when patient's relatives identify that, sir, at time when he was sleeping he was fine, in the morning we found, it is the treatment is different, because then the time onset is considered once the patient goes to sleep. Also, many patients like wake up early in the morning. At that time, they are fine. So, like they wake up early, 5 o'clock. They go to washroom, then again go back to sleep. So, if the patient's relatives know that no, sir, at early morning he woke up, then he went to washroom. At that time, he was fine. After that, he went to sleep, and then this happened. So in that case, the onset of the stroke is considered to be early morning. This is very important, that because the the treatment of the patient varies according to the duration of time. So this is most important thing for a patient's relative to take care of, is to have a accurate or almost near accurate idea of onset of stroke symptoms.
Thank you, sir. I think, as you rightly said, the time is of essence, and noting when these symptoms start happening. Anyone around you, should take care of that so that, proper treatment can be given to them. And, sir, as I've read and as I've heard stories, stroke can be a very, deadly disease where even if you recover, there might be lingering side effects to the disease. So, what would you recommend to someone who's recovering from a stroke?
See, any patient who's that suffered a stroke attack should take care of a few very important things.
Mhm.
To adhere to the medicines those are prescribed, to be very punctual, to take medicines on time, because the medicines which are given after stroke are to prevent a second stroke. Okay,
Mhm.
so patient should take medicines properly. Second is there are many post-stroke effects.
Mhm.
The limbs develop spasticity. So the patient is told to take part in aggressive physiotherapy program, and even after physiotherapy is over, patient can also continue to work on his rehabilitation part.
Mhm.
The second is patient should also avoid some things, like if patient is a smoker, he should avoid smoking. If he's having alcohol, he should avoid alcohol. If patient is having comorbid hypertension, then patient should aggressively address hypertension, patient is having diabetes, then patient should have a very good, should try to maintain a good glycemic control.
Mm-hmm.
So along with stroke, there are whatever the comorbidities patient is having, patient should also aggressively manage those comorbidities with medicine or physical therapy or exercise. Also, many patients develop post-stroke depression. So for depression part, patient can be advised antidepressants.
Mm-hmm.
So there are many post-stroke side effects, and patient, as a doctor, we should try to address to all of them. Also, there is one very important aspect to post-stroke recovery, and that is also the managing issues associated with the caregiver, because the patient has a limb weakness, he has difficulty in walking, and so even the caregiver is having anxiety, stress, depression. So I think that should also be addressed in some way or the other.
I think that's a great point that in addition to the patient suffering from a stroke, the caregiver should also take care of themselves, because their role becomes very important, and if they start suffering from something, both of their healths can be compromised with. Thank you, Dr. Makwana. This has been extremely helpful. And before we conclude, this brings me to my last question. That while we're talking about treatment options and what should one do, I wanted to ask: is stroke preventable?
Yes, taking care of many things can help in preventing stroke. I will just tell about a few things. First is avoid tobacco smoking. Second is have a healthy BMI, watch your weight, avoid obesity. Third is try to have a good lipid profile, manage your cholesterol levels. Okay. Fourth is, if you are having diabetes, you should manage sugar well. Fifth is do daily exercise. Also, patients who are having cardiac issues like rhythm disorder like atrial fibrillation, they should take anticoagulants for that, or antiplatelets, and they should try to maintain a good cardiac status. Okay. Also, so basically, patients should try to maintain a healthy lifestyle. And
a healthy lifestyle.
Somewhat stroke can definitely be avoided. Yeah.
Thank you, Dr. Makwana. I think everyone keeps on saying that. Yes, sir. Yes. Please.
Before concluding, I would just like to give an update on stroke management. So basically, before a couple of years, it was considered that within 4.5 hours, if the patient comes, then only thrombolytic, blood thinning injections could be given. But now, since last quite a few years, along with that treatment, there are endovascular options for treating stroke, especially in patients who are having large vessel occlusion and stroke. In those patients, within first 6 hours, patients can be taken to cath lab where cardiac procedures are performed, and they can be given endovascular thrombectomy, in which the clot which is there in the large vessel in the brain can be mechanically removed by a stent retriever or aspiration method, and patient can have a very good treatment and a very good recovery in those subgroup of patients. In patients who come between 6 to 24 hours, in those patients, a select group of patients can also be selected for mechanical thrombectomy, depending upon case-to-case basis.
Yeah. Thank you, sir. I think this is very insightful. As in, whenever if you have someone who suffers from a stroke, it's important to consult your doctor of the possible technologies that possible advancements that has happened, because as you mentioned, the span of 5 years, so many technology has advanced, and there are better and better options coming up to treat stroke. Thank you, Dr.
Yes.
This has been extremely helpful, and we're all a little wiser about stroke, and I'm sure our viewers also got a chance to learn more about stroke, and it's important to lead a healthy lifestyle so that you keep away from all of these deadly diseases. Thank
Okay,
you
ma'am.
for joining us today, sir.